everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about the importance of providing a safe and a clean environment for the client, right? In today's session, we are going to discuss about the reduction of physical hazards. In today's session, I'm going to teach you about what is the importance and what are the various safety measures that we need to follow in order to prevent these safety hazards from occurring. So under this, the first which we are going to discuss about is falls. So here, as we know that this is a common hazard that can happen to anyone, right? This is a hazard that can happen to anyone at any point of time. Why? Because here people at any age can fall, right? However, it is seen that this falls is usually common in infants as well as in the older adults, and this can also sometimes cause a severe injury. So care must be taken that we should avoid falling, right? So here, certain safety measures can be followed in order to prevent ourselves from falling. Here, what we can do is that if we encounter a client who is having any eye problems, who is using eyeglasses, what we need to do is we need to ensure that the eyeglasses are functional. And even to prevent one from falling, it is very essential that we must ensure that there is a proper lighting. Why? Because if there is no proper lighting, then the client or the person who is walking will not be able to visualize things properly, right? And if he is not able to visualize things properly, then he can also fall, he can trip down, or he can slip. That is why it is important that proper lighting must be there. We should also mark the doorways as well as the steps if it is required. And the important one is that we should keep the environment clean and tidy. So here, in an environment where an individual is in, it is very, very important that all these things must be kept in place. It should be neat and clean, right? We should also set safe limits to activities, and we should also remove any unsafe objects which may be present in that particular room. So here, any objects that may prove to be harmful to an individual, we must make sure that we remove these kind of objects. We should also make sure that we wear shoes or well-fitted slippers with non-skid soles. And if you encounter any client who requires an ambulatory devices in order to be able to walk from one place to the other, then we can also provide them with these devices as required. So here you can provide them wheelchair, you can provide the walker, the cane, the crutches, as well as the braces. Depending on the condition, depending on what they need to use, we can provide them with these ambulatory devices. And also, you may sometimes encounter a client where even after you have provided these ambulatory devices, they still require your assistance, right? So when you encounter these type of clients, you should make sure that you should also assist them in their activities. You should also monitor the gait and balance of the client, as well as you should help the client to adapt to their living arrangements. You should also encourage the client to perform certain exercises, certain activities which can be tolerated by them in order to help them maintain their muscle strength, their joint flexibility, as well as their balance. And if you are encountering clients who are under the treatment process because of these type of cases, then you should also make sure that you should keep the bed in a low position so that it will be easy for them to get down or even to get on the bed. You should also install the grab bars in the bathroom, as well as you should attach the side rails in the bed if it is required. Not only that, but you should also keep the rails in place when the bed is in the lowest position, and also you should always monitor the consciousness as well as the alertness and orientation of the client. So these are the safety measures that you as a nurse need to educate the client in order to help themselves reduce from cases of falling. And the next one here is the fire. So the first one is that we should educate the client who are working in certain occupations where they require the use of this fire, that they should be aware of the fire safety regulations as well as of the fire prevention practices of the agency in which they work in. And when we nurses encounter client with these cases, we should make sure that we protect the client first who are in an immediate danger. We should report these fire cases. We should try our best to contain the fire, as well as we can also help in extinguishing the fire. And the next one is seizure. So what is seizure? Seizure is nothing but a sudden onset of an excessive electrical discharge in one or more areas of the brain. Clients are at high risk of developing an injury if they experience seizures that can affect the entire body of the client, as well as if they experience seizures that can affect their level of consciousness. So here, when we as nurses encounter any client with seizures, what we should do is that we should first try to pat the back of the client, and we should also secure the blankets or any other linens around the head, around the foot, as well as around the side rails of the bed. And the next thing is that we must put the oral suction equipment in place and make sure that this particular equipment is functioning. Why? Because suctioning may be needed in order to prevent aspiration of the oral secretion. And if seizure occurs, then what you must do is that you must remain with the client, as well as call for assistance if required, but you must make sure that you should not restrain the client. And if the client is not in bed when the seizure is occurring, then you must assist the client and also protect their head so that they do not injure their head, as well as you should loosen their clothing, especially the clothing around their neck and their chest. And also it is best if you can turn the client in a lateral position. And why do we do this? We do this because by turning them in a lateral position, that is, by turning them to the side, it allows the secretion to drain out from the mouth. And in this way, it also decreases the risk for aspiration and also prevents the tongue from occluding the airway. That is why here, if you encounter a client with seizures, then it is best if you can turn them to a lateral position. You should also move the items which may be present near the client in order to prevent them from injuring themselves. We should also make sure that we do not insert anything into the client's mouth, as well as we should note down the duration of this seizure. We should also observe the progression of seizure, as well as if it is required, then oxygen can also be provided for that particular client. And if you find that the client is vomiting or has an excessive oral secretion, then you can also suction the secretion out. And you can also administer the anticonvulsant medications if it is required. Now moving on to the next one, that is poisoning. So here, when you encounter any cases of poisoning, the first thing what you must do is that you must try to identify the specific poison. How? By searching for an empty container, for an open container, or any other evidence that you can find, so that it will be easy for you to get to know what did the client consume. And it is also important that when you treat any client with these cases of poisoning, you must lock all the cupboards that consist of the potentially toxic agents. You should also never remove the container labels or reuse any empty container. You should also place the poison warning stickers on these bottles or on these toxic agents. And also here it is very important that we educate the client that they should not play with these toxic agents. They should not refer to medicines such as candy, as well as they should not show that there is presence of enjoyment when they are taking these medications, especially in front of children. We can provide antidotes, as well as if poison is caused by skin or eye, then what we can do is that we can wash the skin or the eye with the use of a large amount of water for at least 15 to 20 minutes. And in case of inhalation exposure, then what you must do is that you must make sure that you remove the victim from the potentially dangerous environment. And if because of this the patient had collapsed, then you can also perform the CPR, that is the cardiopulmonary resuscitation. You should also position the head on one side, and you should never induce vomiting in an unconscious or in a convulsing patient. So these are the various things you can do if you encounter cases of poisoning. Next is suffocation or choking. So this suffocation, also known as asphyxiation, is a condition where there will be lack of oxygen in the body of an individual due to interrupted breathing. There will be a lack of oxygen in the body of an individual, and this condition is known as suffocation or asphyxiation. So whenever you encounter a client with this condition, the emergency response which you can give is the Heimlich maneuver or the abdominal thrust. Why? Because through this way we can dislodge the foreign object which is present, which is causing this interrupted breathing, and when this foreign object is being dislodged, then we can again re-establish the airway of an individual. So since we have discussed about the physical hazards, right, that is the fire, falls, poisoning, as well as suffocation, now we are going to discuss about the electrical hazards. So in order to prevent these electrical hazards from occurring, what we must do is that we must check the cords if they are damaged before using any appliances. So here it is very important that before we use any appliances, before we plug in these appliances, we should first make sure if there is signs of damage in these cords. We should also place a protective cover over the wall outlets. And these electrical appliances should never be used or should never be near the sink, bathtub, shower, or any other wet areas. And especially if there is presence of children in that particular environment, in that particular setting, it is very important that these electrical cords and appliances must be kept out of their reach. So in order to prevent the electrical hazards from occurring, these are the various things we can do. And the next one is radiation. So here radiation injury can occur because of the overexposure to the radioactive materials which is commonly used in the therapeutic procedures. So here, as we know that there are various therapeutic procedures in which if we need to perform, we need to be exposed to these radioactive materials, right? So if an individual is being overexposed to these, then it can be harmful, right? So this exposure to the radiation can be minimized by limiting the time from the source as well as providing as much distance as we can from the source and using shielding devices such as lead aprons whenever we are near that source. So this is what we can do in order to prevent overexposure to these radioactive materials. So now let us discuss about these safety devices which we can use for the client in order to prevent them from any hazards. The first one is the restraint. So what is restraint? Restraint are the protective devices which is used in order to limit the physical activity of the client or even a part of the body of the client. So whenever you need to limit the physical activity of the client or whenever you need to limit a particular body part from moving, then we can use these restraints. These restraints are of two types. The first one is the physical restraint and the second one is the chemical restraint. These physical restraints include the mechanical device or any materials or equipments which is attached to the body, whereas the chemical restraints are the medications which we will be providing to the client. For example, the sedative. And the second one is the side rails. So these side rails, where they are found on the bedside, right? Helps to increase the patient's mobility and stability when they are in bed or when they are moving from the bed to the wheelchair. These side rails are also used in order to prevent the client from falling down from the bed. So here we as nurses must always ensure that the latches securing the bed rails are stable. The next one here is the airway. So whenever you encounter any client that has a difficulty in breathing, that is if they are at a higher risk of their airway to be obstructed or if they are already having an obstructed airway, then an artificial airway can be inserted in order to maintain this airway patency. And the next one is trapeze. So what is this trapeze? This is simply a item in which it provides a support for the client in order to be able to get up in bed. So these are the various safety devices that you as a nurse can use for your client in order to prevent the hazards from occurring. Now moving on to the next, that is the role of a nurse in providing a safe as well as a clean environment. So here, in order to prevent the client from injuring himself or herself, it is very important that we as nurses, especially in the hospital setting, we must provide a safe and a clean environment, right? So what are our responsibility? The first one is that we must ensure that there is an optimum temperature in the ward. Why? Because here if the temperature is too low, then it can lead the client to suffer from frostbite, whereas if the temperature is too high, then it can also lead the client to suffer from heat stroke, right? So in order to prevent this from occurring, what we must do is that we must ensure that there is an optimum temperature in the ward. We must also ensure that each ward must be well ventilated. We must also ensure that the noise is within the prescribed level. Why? Because in this way, it will help the client feel more comfortable, feel more at ease. We must provide sufficient light, as well as we must ensure the rodent and the pest control. We must always update the safety precautions for fire breakout. And we must also make sure that the risk factors for falls must be eliminated. So these are the various roles of a nurse in order to be able to provide a clean and a safe environment. So now we have come to the end of this topic. So in today's session, we have discussed about the safety measures for preventing hazards, right? We've come to know that there are various types of hazards that can occur in the hospital setting. It can be the falls, the fire, the poisoning, suffocation, chemical hazards, as well as the radiation. So we've discussed about what are the safety measures that we can follow in order to prevent these hazards from occurring. We've also discussed about the safety devices which we can use for the client, as well as what are the various roles of a nurse in order to provide a safe and a clean environment. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session. Until then, have a good day. Thank you.